today, I'll be inviting the founder of Health for Nigeria, Professor Abimbola Akintade, to also come in and give us really the reason why we are here, how Health for Nigeria started. Professor Abimbola Akintade is the Associate Dean of the Master Specialties at the University of Maryland in Baltimore, US. He's a well-rounded clinician with leadership experience in a variety of settings, including universities, tertiary care, hospitals. Is driven by strong management and business skills grounded in evidence-based practice, clinical outcomes, and service-oriented philosophy. So as the founder of Health for Nigeria, this means a whole lot to him to give back to Nigeria, because as he's doing quite a lot in US, he also wants to make sure that he doesn't forget his home country and to tackle the challenge of healthcare and leadership in Nigeria. So Professor Abimbola, thank you for coming on board today. We would like to just give the floor to you to give us a little bit about Health for Nigeria and tell us, how it came about.
Well, thank you very much, Ola. Can you hear me?
Yes.
All right, wonderful. Well, thank you very much for the introduction. Thank you, Mrs. Otobo. Thanks for everyone here. I'll stand on the existing protocol just so we can respect time. But today is a very special day for me, obviously, and I'm very excited to be here. I'm going to spend the next just few minutes talking about Health for Nigeria and just to answer a few questions that have come up over time. So what exactly is Health for Nigeria? Well, we're a nonprofit, non-governmental organization focused on ensuring basic primary healthcare is available and equitable to all Nigerians, regardless of socioeconomic status. We aim to accomplish this through three different mechanisms. One, by increasing the capacity of healthcare professionals in the area of leadership and management, as I know we can all agree that that area is lacking significantly for us. By strengthening and potentially expanding the nursing profession to help mitigate the significant shortage of doctors in the country. So for those who don't know, for a population of over 200 million Nigerians, we have only about 35,000 registered doctors in the country. And the last thing, and one of the most important things I think for us, is elevating and also defining the health standards for our school system in terms of healthcare. So a lot of people have actually asked me why, why am I interested in, Health for Nigeria? I'm in the US, what is my connection? And, this is one of the most significant reasons why. So this is my mom. This is Mrs. Gladys Moaninola Akintade. And she's the first person I ever met who had high blood pressure. She's actually the first person, one of the hardest working women I've ever met also. And I remember this vividly as a child growing up in Nigeria, because I used to have to go purchase her medications. She had just a really, really bad case of hypertension. Well, I left Nigeria in 1996. My mother passed away in 2000. And it was really unfortunate because she had a heart attack. She made it to the hospital. And unfortunately, she wasn't treated because my dad was out of town, so there was no one to pay for it. So broken system, they basically watched her die. I've been in the US ever since. I started my career in nursing. A lot of people don't know that. I became an advanced practice clinician. I earned my doctorate here. My specialty is trauma and critical care with a focus on cardiac care. I'm sure you can make the connections. And since, I've spent a lot of my time in academia. I still practice. But most of my time is spent in healthcare leadership and academia. I've earned multiple promotions. The current associate dean for the master's programs at University of Maryland. I was appointed by the governor of the state of Maryland as the commissioner for health for Maryland. And every time I think about the successes I've attained, I worry about Nigeria and the health sector in Nigeria. So this is an opportunity to give back, to the health sector in Nigeria. So Mrs. Otobo talked about our mission and vision. And if you haven't been to our website, this is a wonderful opportunity for you to do so. There's a lot of wonderful information there. I'll touch very briefly on our journey. So even though the organization was registered in October 2019, the conversation had started long before then. I met the CEO for Teach for Nigeria, Folawe Omekunle, several years back, who had talked about how work in the education sector, and how within every conversation about education in Nigeria, um, health is always intertwined. So that's also a sector that's heavily under managed. So we officially launched in January 2020. And during the pandemic, this was an opportunity for us to give back in terms of reentry of students back into schools. So we kicked off the Nursery School Initiative in May 2020. The first school clinic and sick bay was refurbished in November 2020. And there are several other nursery school initiatives in various levels of completion at the moment. So just a quick shout out to our board of directors. And you heard Mrs. Otobo earlier, who has really stood, in the space as a board chair for us. So we're very appreciative. This is our advisory board, who have also been very instrumental in our growth and development. So we're very appreciative for their help and their support. This is the team, the operations team, that's behind a lot of the wonderful work we've done so far. And I believe they're all present here today. I'll spend the last couple of minutes talking about the Nursery School initiative. And this was at the launch at Basham Rojo that Mrs. Otobo spoke about earlier. Another very proud moment and landmark initiative for us. So we have a tripartite approach, and we have three very important things we're trying to accomplish with the Nursery School program. One is the COVID-19 support and resiliency building, which helps with reintegration and awareness, educating the teachers, the faculty, and the students, providing basic first aid services to the teachers, the students, and staff. And the most important one is the development of a health club, which starts to create healthcare awareness in children at a very early age. So these are initiatives to establish sick bays with registered nurses, create these health clubs, most importantly, ensure that at least 80% of students who fall ill or who are injured in school receive immediate care through the school nurse, or they get referred to PHCs, and to provide 100% of the staff and the students with adequate knowledge of infectious disease and preventive measures, which are things that we're lacking significantly. So this is a completed project, the Basham Raja High School, with all the necessary equipment. If you go to our website, you can see some more pictures and also videos. And I'll just spend the last minute talking about how you can provide support to Health for Nigeria. I know a lot of us are well-meaning. A lot of us also want to do something positive for the country, but there are concerns of transparency and also equity. There are also concerns about management of funds. Well, we're transparent, and we've maintained a very professional attitude and approach from the beginning. Due to our research and calculations, with about the approximate value of $5,000 a year, we can refurbish a space, turn it into a sick bay or a clinic, and hire a nurse and have the nurse serve in that clinic for a whole year. So that comes up to a little more than 2 million naira if we're converting the amount. So for additional information, please log on to our website, or please call this number, or you can send us an email at info@healthfornigeria.org. We're very responsive, and we would love to partner with you given the opportunity. So thank you once again, and I look forward to a fantastic panel discussion. I'll hand it over back to Shola. Thank you, thank you, thank you.
Thank you, Professor Akintade, for sharing that very beautiful story with us for how Health for Nigeria started. I didn't know the origin of the story, but I've always known that you've been involved in cardiac care. It's good to know that there's actually a passionate story that's tied to that. And Health for Nigeria, I'm really very impressed with how quickly you're getting things done. And I think that would speak to the fact that you have been running this and talking about it for a while. Thank you so much. Thanks to the board of directors, and thanks to you guys for bringing all of this program together. We're looking forward to an amazing discussion here.